Hello, everyone. Welcome back to Luncheon with the experts at Carcinoid Cancer Foundation, brought to you by Prrt Therapeutics. It is a new year, 2021. We haven't seen you in a couple of weeks, and we're glad to have you back. If you are a regular, you know the drill. Let us know where you're signing on. Hello from Cleveland, Ohio, Montgomery, Texas. Let us know where you are in the world. We'd love to see how far these programs reach. This is one of the coolest things about it is we have people from all over the world tuning in live while we broadcast this. My name is Rain Bennett. I will be your host as always, and I'm a filmmaker that's been working with the Carcinoid Cancer Foundation for almost a decade now to create video content that helps spread awareness and education about neuroendocrine tumors. A lot of the content that we do now is the Luncheon with the Expert series, but we also have produced videos that we do. And this year we are releasing a series, very heavy treatment-based series. We've done a patient-centric series before in 2018, and now we are focused on a treatment-based series that talks about all the, many different elements of neuroendocrine tumor surgery, clinical trials, Prrt, a lot of different things. So if you want to see that content, or if you want to see previous episodes of the show, you can just go to the videos tab here on the Facebook page or to the Carcinoid Cancer Foundation YouTube channel. So we'd like to take a moment to thank our sponsor, Prrt Therapeutics, for their support of Luncheon with the Experts series. We wouldn't be able to do this without them. And we have a little disclaimer that we like to say at the top of the program from them. So we want you to know that the opinions expressed by the guests, as well as the questions asked by the audience that you all at home, haven't been created or suggested by the sponsors of the program. And CCF does not endorse or promote any of the views, opinions, or information presented in the program. Audience members, again, that you all at home, should not rely solely on the opinions expressed by the guest today and should seek guidance and direction from their own medical advisors regarding any decisions or choices they make about their health or treatment. So that last line is definitely the takeaway. We're going to give you some great information today and hopefully some good guidance and direction, but by all means, we do not know your specific case. So talk to your home team. That is super duper important. So today our guest is Dr. Jerome, also known as Jerry Zacks. How are you doing, Dr. Zacks?
Really well. Good to see you, Rain.
Good to see you again. We have had you before on the previous iteration of the show. It wasn't Luncheon with the Experts, but we had a Facebook Live program last year when we could be in person, and I was there in your office doing that with you. And I've worked with Dr. Zacks for a few times for some of the video content for CCF over the years. Dr. Zacks, I know that you have a little bit of experience in this realm, in this neuroendocrine cancer world, maybe just a year or two, right? For those that aren't familiar with you, tell us a little bit about how long you've been working with this disease, in what capacity, what role do you consider yourself filling in this overall community?
So I'm really a member of a neuroendocrine tumor center team, which meets virtually now every week, every Thursday evening. In fact, this evening we'll be meeting to review all new cases, and there are about 15 or 20 members who chime in for every meeting. And before the pandemic, of course, we were meeting at Mount Sinai in person. And this all started about 30 years ago or so when Dick Warner asked me to get involved as a cardiologist. He asked me if I would take care of neuroendocrine tumor patients that had the carcinoid syndrome. Mm-hmm. And I said, but Dick, I don't really know much about it. And he said, well, you'll learn. And so over the years, he has been my mentor. He's still alive and living in Denver. I'm in touch with him just about every week. And if I present a case to him, he's quick as a whip. He's unbelievable. And the only reason he retired was because of Parkinson's disease, difficulty ambulating.
Yeah, he is still, I know Dr. Warner very well. For those that don't know, he is the person who founded the foundation a long, long time ago. Sharp as a tack, still very, very knowledgeable and willing to share that knowledge. I've got the chance to work with him quite a bit over the years, and it's just like, still impresses me as I think he's maybe 93, 94 now. And it's just, what a guy.
He taught me to focus on the patient.
Yeah, absolutely. Absolutely. So at that point, that was the first time you had seen or heard of this disease, or you'd heard of it before, but just didn't have much
Well,
experience
as
with it?
a cardiologist, maybe once a year you would see a carcinoid patient.
Got it.
And so I had very limited contact and mainly someone who he would send to me.
Right.
Um, and since that time, things have evolved, and I've been on
Sure.
the guidelines committee for ENETS, which is European Neuroendocrine Tumor Society, and for NANETS, North American Neuroendocrine Tumor Society. So I guess I've learned a little bit over the years.
I'm sure. And I can't wait to dive into the evolution of how we diagnose, how we treat this disease that you've witnessed over 30 years. So for everybody at home, go ahead and start sending your questions in. Now you know a little bit about Dr. Zacks and what he specializes in. Just in an FYI, as we get going, we kind of alluded to this already with the disclaimer, but we don't know your specific case and we're not able to dive into that today. So please know that when you ask your questions, we want to try to give you the information that we can to help you, but we can if it's super case specific. So try to form your question or formulate your question in a generic way so that you can get the information that will help direct you. And if you have follow-up questions, I highly encourage you to reach out to Carcinoid Cancer Foundation after the program. You can message them here on their Facebook page, or you can reach out at carcinoid.org. But just know that if it's too deep and too case specific, we won't be able to get to it because Dr. Zacks doesn't know your case. That being said, we're going to try to get to as many questions as we can to get today. So go ahead and start sending them in. And the last thing I like to say that this really helps, and you guys have been doing a great job of it, is if you see a question in the comment thread, and a lot of times you all are having your own conversations over there, which is great. I love that. If you see a question that you also would like the answer to, or you also are interested in hearing about, you can like that question. You can hit the like button on that actual individual question. And for me, as I'm scrolling through, it allows me to see, oh, there's the demand there. 4 or 5 or 6 people have liked that question. I will make sure that we get it across, because inevitably this is a good problem to have. We get so many questions, we inevitably can't get to them all, but that's a way that kind of like upvotes it a little bit so that I can see it. And before we get started, finally, I want to say, have you downloaded CCF's free Net Cancer Health Storylines app? This application makes it very easy to record your symptoms, medications, nutritional concerns, your moods, and everything else. So if you haven't checked that out, we will put a link to it in the comment thread. And that being said, if we have any resources that Dr. Zacks references or anything like that you would need to visit a link to see, we're going to try to add that to the comment thread so that you don't have to leave the conversation, and you can still access those or come back and access them later. They'll be in the comment thread, and this video will live here on the Facebook page and it will be evergreen. So you can always come back to it later. Try to really engage and ask your questions. And if you know anyone else that would benefit from the live presentation today, go ahead and tag them, share this video, get them over here. Let's have a chat with Dr. Zacks. So Dr. Zacks, let's go back to that. Let's go back to that moment where Dr. Warner kind of pulled you into this space. At that point, did the amount of patients with neuroendocrine tumors that you dealt with increase like immediately, or was it kind of a gradual thing when you started serving more of these patients?
Well, there was a fairly steep curve in
Got
terms
it.
of the number of patients. Um, Once he, I guess, decided that he would need my help on a regular basis, uh, the curve was fairly steep. As you know, we're talking about a fairly rare disease, and approximately 50% of patients with the carcinoid syndrome will, through the course of their disease, at some time have carcinoid heart disease. And so there were a considerable number of patients. Early on, I would usually end up seeing them fairly late in the course of the disease. And now I'm seeing them earlier and earlier because we're teaching people to do an echocardiogram if you have a neuroendocrine tumor. So we're picking them up much earlier.
Now, what problems or challenges did that present for you when you were seeing them later in their journey?
So it meant that a large percentage of the patients required open heart surgery
Mhm.
to treat the valve disease. Typically, the right heart, tricuspid and pulmonic valves are affected by carcinoid because they're being fed high concentration of serotonin from the liver, and the liver drains directly into the right side of the heart.
Got it. So before we get started, let's lay a little foundation for everybody. Let's give a very simple, if you can, definition of carcinoid heart disease. What exactly is it? What causes that? I know that we've already talked about carcinoid syndrome, but for those that aren't familiar with it, what is carcinoid heart disease?
It's a great question. It's an important question because it is not usually involving actual tumor in the heart. Only 5% of patients with carcinoid heart disease have actual tumor metastasis in the heart. We're talking about the effects of tumor predominantly in the liver, which are secreting a high concentration of substances which drain through the inferior vena cava up to the right side of the heart. And we feel that serotonin is the most damaging in terms of causing scarring of the valves of the heart. So we're really talking about a disease of damaged valves, scarred valves, which is caused by a substance secreted by tumor, not necessarily by tumor itself directly.
Got it. And can you get, and forgive, pardon my ignorance here, but can you get carcinoid heart disease if you aren't experiencing carcinoid syndrome, or is that the
So,
precursor?
yes, you can.
Okay.
However, serotonin usually causes other symptoms such as diarrhea and sometimes flushing. And don't forget, serotonin is only one of about 18 possible other substances which are secreted by neuroendocrine tumors. And so the carcinoid syndrome, although it's to a large extent serotonin involved, it's really involving histamine and other substances as well.
Got it. For those at home listening, I see that you're Dr. Zacks. Unfortunately, you can't see this, but I'm going to let you know. They're sending some thumbs up and heart emojis. Basically, that's saying that it seems like they're, liking the answer. It's giving them good information. So I just want to encourage you all at home. That's a great visual way for us to see that we're doing our job. So if you get some good information,
You also have to let me know if you see a lot of thumbs down.
I'll definitely let you know that. But guys, he needs to see the thumbs up and the heart. Look, they're coming in now. They're flooding in now. So the people love you already. Okay, so I know that people have a lot of questions. I also have a lot of questions, but it's not about me. So I'm going to go ahead and pivot to some of the questions from the audience, Dr. Zacks. We have one from Judy who says, can precordial thrill / heart murmur mimic or cause orthostatic tremor / vertigo-like symptoms, or are tremors linked to carcinoid syndrome for NET patients with heart valve stenosis? That was a mouthful for me. Did you follow?
Yeah, no, I did. I did
Okay.
follow, but specifically about the tremor. Some of the substances are like stress substances, and they may cause tremor. Other neuroendocrine tumor diseases, such as pheochromocytoma, can cause tremor. And in the carcinoid syndrome, you can have it. Although, if you look at the list of things that are making up the carcinoid syndrome, tremor is not specifically listed. But I would never say that, no, it's not due to carcinoid syndrome. It's probably related to substances secreted by the tumor, but it's not commonly a part of the carcinoid syndrome.
Got it. Thank you very much. And thank you, Judy, for your question.
That I answered some of your question.
Thank you, Judy. Judy is joining us from, that question came from Australia. So as you can see, we are literally reaching.
Welcome.
What's that?
Welcome to Judy.
Yeah, absolutely. Next question from Peg. This question is about the NET test. So the question is the NET test alone adequate for monitoring carcinoid?
You know, the NET test is relatively new, and most of us feel that as time goes on and we learn more about the specificity of certain genetic patterns, that I think it's going to prove very, very useful. Those who are experts at interpreting the NET test would probably respond by saying, well, Dr. Zacks is not the most knowledgeable of with the patterns. And so I would say that we should start using the NET test more so that we learn more about it.
Yeah, thanks for saying that, and thank you for your question, Peg. This is something very new, and there are a lot of opinions out there about it. I just want to tell everybody at home, the first episode of Luncheon with the Experts, which is way back in July 2020, was with Dr. Maudlin, the creator of the NET test. So highly encourage you, if you have questions about that or interest about that. We had a whole episode where we talked about it. And so you can go back and see that here on the videos tab. If you want some more information. Dr. Zacks, I have to say that Joanna says in all caps, Dr. Zacks is the best doctor ever. So just so you know. That got a big smile
Hi
from
to Joanna. I just wanted to clarify, where is Peg from?
Oh, I'm not sure. Not everybody.
Okay.
Not everybody lets
I just
us.
wanted to see in case I was confused.
No. Okay, so let's see some more questions from the audience. Okay, got a question from Effie, who's one of our top fans. Effie's here almost every week, I believe. Is or could pericarditis, am I pronouncing that right? Pericarditis be a result of carcinoid syndrome?
Yes, theoretically it can be.
What is that, Dr. Zacks?
It's inflammation of the sac around the heart, which is called the pericardium.
Thank you.
It can be, it could be related to tumor affecting the area adjacent to the heart, and therefore creating irritation of the pericardial sac. And if it's significant, you will start to see fluid forming in the space between the pericardium and the heart. And the echocardiogram is really the way that we evaluate that. Let me just say a word about the echocardiogram.
Please.
It's one of those rare situations in which you have a test which is 100% sensitive and specific for the carcinoid heart disease. In other words, we make the diagnosis of the presence or absence of carcinoid heart disease by using the echocardiogram. And it's so sensitive that it's just incredible. We can say, yes, you have evidence of it, or no, you don't, very accurately.
Thank you. That was very simple explanation for someone like me. I need that. And also the audience responded too. A lot of thumbs up just came when you said that. So, so to that point about the echo, we have a question from Neom, I believe. It says, I get a racing heartbeat with no obvious triggers periodically. Echo, Holter, and ECG normal. Is there anything else that should be checked?
So it's very significant if one is actually experiencing this type of palpitations. And the question we ask right away is, does it feel like skip beats, or is it more a rapid beating, and does it come on gradually or suddenly, and does it leave gradually or suddenly? It gives us an idea of what the possibilities are. When someone has these complaints of palpitations, the first thing we do is do a careful history, physical exam, EKG. But then the next step is to take chest x-rays and to order a 24-hour Holter monitor test in order to confirm whether or not there's frequent irregular beating of the heart. Almost everyone on a Holter will have an occasional extra beat. And so just having occasional extra beats is not a problem. It's usually when you're having them frequently enough that you're actually aware of them, it's bothering you in some way, that we want to characterize what is it, what's the cause. The echocardiogram helps us determine that. The blood pressure helps determine that. and then what's the proper treatment?
Got it. Thank you. And thank you for your question, Liam.
Liam, that was a good question.
From Dorothy, Dorothy says, if we don't know we have cardiac problems due to syndrome, what specific symptoms should we be looking for?
So, first of all, any chest symptom can be related to carcinoid heart disease. I'm not sure if Dorothy is asking specifically about carcinoid heart disease or the carcinoid syndrome.
She's saying if we don't know that we have cardiac problems due to the syndrome, what symptoms should we look for?
Oh, okay. So that's a very good question. The earliest sign of heart failure related to carcinoid heart disease is swelling of the feet and ankles. And if nothing is done about it, that swelling starts to rise up the legs. And the worse the heart failure is, the higher the edema or swelling is. And it can go as high as the waist. And when it reaches the waist, it's often associated by fluid developing in the abdomen, which we call ascites. And then if we don't do anything about it at that point, you start to develop higher level of fluid, and it reaches the pleura, the area around the lungs. And then you get fluid around the lungs and you become short of breath. And so what we're talking about is the heart failure that's the result of valve disease created by the damaged valves due to serotonin and other substances.
Thank you for that very specific answer, and the people responded. And thank you, Dorothy, for your question. Moving right along, because we have a lot today, so the questions are flying in and our numbers are rising, which makes us excited over here. From Sonia, can carcinoid syndrome, and she puts in parentheses lung here, so I'm assuming she has a lung net. Can carcinoid syndrome lead to renal disorders?
Actually, the renal disease associated with carcinoid syndrome is often not actually due to the substances secreted by the tumor, but due to the drugs that we have to use to treat the disease. So that's the most common cause of the renal disease, which we often see as we're treating patients with the carcinoid syndrome.
Got it. Thank you. Next question from Keith. Is there any clinical evidence showing Somatraline depot helps stop heart valve disorder due to carcinoid syndrome?
So basically, the somatostatin analogs, of which Somatraline is one, help reduce serotonin level and helps to halt the progression of tumor growth. Now, therefore, the progression of the scarring of the heart is, we think, reduced. However, when we looked at all of our patients who are on these drugs, I must say that the majority of them did not achieve a reduction that brought the serotonin down to a normal level. And therefore, we really celebrated the advent of a new therapy which blocks the production of serotonin, and that's the drug Zermelo. Zermelo can actually reduce serotonin down to a normal level. And I presented 2 cases early on when we first started using it of 2 patients who we thought were headed for open heart surgery, but it has, even to this date, halted the progression of disease, and those 2 patients have not required open heart surgery. So it's a combination, but remember now, we're using Zermelo after we've already instituted therapy with Somatraline or with Sandostatin LAR.
Got it.
So we need all of them together in order to try to achieve a normal serotonin level.
Awesome. Thank you, Keith. Hopefully that helped. Dr. Zacks, what are some of the things that have happened or abilities that we've gained over, in your time in the past 30 years that have made the most significant leaps forward in terms of how we treat this disease?
Well, the somatostatin analogs first,
Mm-hmm.
and along with that, the surgical approach. We pretty much agreed that you should try to remove as much tumor as possible.
Mm-hmm.
That helps reduce these substances. And then coming along with a drug that can actually, even after surgery and after you've put the somatulene on board, to further reduce serotonin by using Zermello has been a great help. Up until the time that we had Zermello, out of 27 cases that I presented of carcinoid heart disease that underwent surgery, only one achieved ultimately a normal serotonin level. So that was shocking to us. We were assuming that after we replaced the valves and then Dr. Warner would send these patients for surgery and all of these drugs and everything, that we would get down to the point where we would not see recurrent disease on the newly implanted valves. Turns out that only one patient achieved a normal serotonin level, and the majority, about 50%, it was 46%, had recurrent disease very early on within the first 2 years after getting newly implanted tissue valves. That was, we were really distraught over the fact that we had to reoperate on those patients in order to save them. And so now with the advent of Zermello, the addition of Zermello, it's been wonderful. And then if you still do not achieve a normal serotonin level and you have progression of disease after you've had newly implanted valves, we now have the ability to do a transcatheter valve-in-valve procedure so that you don't need a repeat open heart surgery. It would be very rare now to need a second open heart procedure.
Got it. Thank you. Folks, if you're just joining us or if you joined us late, this is Luncheon with the Experts. We are about halfway through with today's episode, almost. And our guest is Dr. Jerry Zacks from New York, which I haven't been able to get up there in a while. But I have spent some time with him before up there. And I can tell by the people attending that you're getting a lot of value today and a lot of great information, because the emojis and the hearts and the thumbs up are flying in. No thumbs down, Dr. Zacks is, if you can imagine that yet. But what I wanted to tell you all at home is, if you're getting information that is helping you, which I clearly see that you are, and you know someone else that would benefit from this, we've got 30 minutes left with Dr. Zacks. Go ahead and tag them in the comments, or you can share this video to their profile. Try to get them here so that they can get questions across that they may have that would help them in their journey. But if they can't, or if you want to revisit this presentation, just know that you can come back. It will be evergreen. It will live right here on the Facebook page. And starting on Monday of next week, we will republish it to the YouTube channel of Carcinoid Cancer Foundation. So you can always refer back to it, but it's best if you can be here and ask these questions and it be interactive. So if you know anybody that would benefit, go ahead and send them our way. Dr. Zacks, we're going to move forward still with some questions. We just were talking about the treatments that have helped, over the past 30 years. I know one of them is Prrt, which got approved in the US just about 3 years ago, I think this month. So I have a question from Ruby about Prrt specifically, and says, "Good morning, Dr. Zacks. What conditions would make having Prrt treatment dangerous?"
Thanks, Ruby. I would say number one would be poor kidney function, where we have trepidation in those cases. We will sometimes still give PRRT very cautiously, altering the plan in order to decrease the amount of radiation. But that's the main thing. I would just say that in general, those patients who stay physically active and who pay attention to risk factors, As a cardiologist, I usually refer to them as cardiovascular risk factors, but there are health risk factors. Those who are, it's analogous to flying an airplane. If you're flying an airplane, you look at the instruments frequently enough and you correct for any abnormality, you don't have a crash. So it's kind of the same thing in taking care of your own health. If you pay attention to what's going on, you try to identify anything that's not quite normal and you do something about it, the likelihood that you're going to get into trouble is reduced. And also keeping yourself healthy helps you fight the tumor. It goes hand in hand. So I think those are the major factors.
I think that's such a great point, about being active, but also about, tracking your, measuring your stats and tracking. I mean, that applies to almost anything that we're trying to achieve or any progress we're trying to make, right? Is like looking at the numbers, adjusting when you need to. I think that's such a great life point to me, especially when it comes to health, when it comes to anything that we're trying to achieve, like looking at the numbers daily and keeping track of your measurements. I think that's a great point.
I might just add that you can ask your doctor if you read about something and you wonder whether it would be helpful to do something about it. Ask your doctor, and usually your doctor is able to say, well, yes, we have data to support it, or he may say, we're not sure yet. He'll try to orient you and adjust things so that it's reasonable and makes sense.
Absolutely. So next question from Joanna. Joanna says, I know high serotonin causes valve damage, and for those of us who suffer from carcinoid syndrome, this is a given that we will get carcinoid heart disease. What is out there to control or decrease the serotonin levels from the tumors?
So Joanna, that's of course a great question. That's the primary important question. So we look at it from the standpoint of where is it coming from? In the majority of patients with carcinoid heart disease, it's usually coming from a high concentration of tumor metastases in the liver. But occasionally we'll see a patient who has no liver involvement at all, and they still have carcinoid heart disease. So keeping in mind that this is due to substances entering the right side of the heart, you have to ask, well, then where could it be coming from? And the second most common place would be from the pelvis, from ovarian carcinoids. Ovarian carcinoids drain into the inferior vena cava, bypass the liver, and go directly to the heart. So occasionally we have had ovarian carcinoid patients with carcinoid heart disease. I'm trying to remember if Joanna had another question there. Was it about what else can we do to reduce it?
Yeah, let me go back and make sure. What is out there to control or decrease serotonin levels from the tumors?
Yeah, so when we have our weekly tumor board, one of the first things we do is review all of the imaging and see how much tumor is there in the body, where is it located, and is it just in one little area so that we could, for example, predominantly in the liver and not too much elsewhere? Can we just do liver-directed therapy? And there are different types of liver-directed therapy. There are microspheres that can be injected into the artery directly towards the tumor in the liver and to try to decrease the blood flow and kill off those tumor metastases in the liver. And there's PRRT if it's more in other parts of the body as well. And of course, we have Zermello to deal with the substance, the serotonin secreted by the tumor. And just by debulking in general, whether it's surgical debulking or chemical debulking, we have chemotherapy. Just by reducing tumor mass, we generally find that our tumor markers, including serotonin, go down. And I must just say a comment about tumor markers, because the most useful are probably pancreastatin and serotonin. Chromogranin A has been affected by PPI therapy. That's those anti-acid drugs that we're commonly prescribing, such as omeprazole, which is Prilosec, and stuff, that causes a false elevation of chromogranin A. And
Hmm.
we're concerned about that because that was our primary marker.
Right.
But the breakdown product of chromogranin A, which is called pancreastatin, is not affected by those drugs. And so now we rely more on pancreastatin as one primary marker and serotonin. Those are two, I would say right now, most important markers, although there's a whole panel of markers that we do when we initially see a patient, because occasionally you'll have a patient with another marker, which is very useful to follow. And if you follow these markers as you're making changes in therapy, you can actually see a response to therapy and that the markers go down.
Friends of the foundation, this man is a wealth of knowledge. I'm very excited about this episode. Dr. Zacks, can't thank you enough. I'm going to keep moving forward with questions because we have a lot of them. Tracy says, this is kind of to your point about, putting yourself in the best physical shape, staying active, etc. And Tracy says, I can't sit, stand, or lay flat with more than 15 to 20 minutes without my blood pressure dropping. And I can't walk for more than 30 minutes without my blood pressure shooting up. So I've been told that I have POTS as a symptom of carcinoid syndrome and vipoma. Are there any suggestions about what I can do to be more mobile?
Yeah, so with my patients, being a cardiologist, I have almost all of my patients checking their blood pressure, both sitting and standing, so that as in Tracy's case, there can be a significant difference. And so you want to know each day, what is your fluid status, your fluid volume? Intravascular volume is what's determining that, and your body's response to that intravascular volume. So by checking your blood pressure each morning, sitting and standing, you have a good handle on how low does it go and how high does it go, and how does it change with variable positional changes. And then depending upon the results of that, we either tell the patient, well, you have to drink more water. I'm usually not advising patients to take in more salt, but Tracy has a situation where sometimes if you keep advising them to avoid salt, their blood pressure can actually drop too low when they stand up. And so I don't want to say blanketly avoid salt and drink fluids, but for the majority of patients without the POTS syndrome, the advice is to, if you have a tendency towards high blood pressure, avoid salt and drink more free water.
And what is the acronym POTS?
Paroxysmal orthostatic, I forget what the T is, syndrome. Hopefully Tracy will send a little note as to what the T is.
Yeah, I wasn't tachycardia.
Tachycardia syndrome, yeah.
Sure.
So that when she stands up, or when people with that syndrome stand up, along with a drop in blood pressure, they can get a tachycardia.
Got it. Thank you. I appreciate
So
that.
very often drinking extra fluid, if they're experiencing that, very often that will help. And we have some drugs, beta blocking drugs, which can kind of blunt that reaction as well.
Okay. Good to know. Thanks, Tracy. Next question, friend of the foundation, Karen. Good to see you, Karen. Dr. Zacks, do you recommend COQ10, which I'm unfamiliar with what that is?
CoQ10.
Say it again?
Coenzyme Q10. They usually
Okay,
abbreviate
coenzyme.
CoQ10.
Got it. So what exactly is that? And then Karen's question is, do you recommend it?
Okay, so we use it very specifically, predominantly in patients who are on a statin medication for cholesterol.
Okay.
And the theory is that coenzyme Q10 gets depleted by the drug that we're using, by that family of drugs that we're using. And therefore, if you give, and the recommended dose now is quite a high dose, 600 milligrams a day, very often that's enough to prevent the depletion of CoQ10. Now, then you'll ask, well, what does it cause if it's depleted? It causes muscle aching. Mm-hmm. And in its most severe form, it can actually cause a severe irritation and destruction of the muscles.
Got it. I have an interesting question from Lee, which I know is on the minds of lots of people, especially net patients. Are those of us who have heart conditions, even though mild, and neuroendocrine tumors at greater risk for COVID? Here we are still going through this almost a year later. What are your thoughts on that? And that we're still facing
Yeah,
this
so
pandemic?
this virus, as we're learning, as we're going along over the past year now, especially, can affect any part of the body, the brain, the heart, the muscles, the liver, the lungs, especially. That's probably the most deadly effect of the virus. And so if you already have a problem, then it's like turning up the volume on the radio. It just makes it more likely that you'll suffer more if you get the virus. So, the emphasis right now over the next few weeks has to be on wearing your mask as much as possible, especially if you're within 6 feet of somebody else, or especially if you go out walking. And I must tell you that in the New York area, the people are wonderful. You rarely see a person walking down the street without a mask. I don't remember when the last time was that I did. And people are just wonderful. They understand that if they're in a situation in a store where they might get close to you, they limit the time that they're close to you. They separate themselves. They wait in line with spaces. Just wonderful. Now, I just want to make a comment that we
Please.
are emphasizing the washing of hands, and soap and water are probably even more effective than the alcohol-based hand solutions, although that's helpful also. But I must tell you that in all of my reading so far, I have not read of a single case where they've said this person got the COVID virus by touching something that someone with the virus had. So it's a theoretical possibility. And so we're still saying wash your hands if you're touching doorknobs and things like that. But the truth of the matter is that the predominant mode of transmission is by droplet transmission, by people coughing and sneezing and talking when they're very close to a person with the virus. And the problem is that you may be a carrier of the virus and not know it. That's why we're all wearing masks. Even if I've tested 3 times negative, I still wear a mask to protect others from me, because maybe today I got it and
Right.
didn't realize it.
What are they called fomites on the surface?
Right. If you think about it, it makes sense to wipe things down. If somebody sneezed on your package and you just picked it up and got it on your hands, and then you touched your face and eyes and
Sure.
that's a theoretical possibility. So we just take the precaution, even though it would be very uncommon to get it from shopping or touching fruits and vegetables, especially if you rinse your fruits and vegetables as soon as you go to use them and things like that.
Got it. All right, thanks. Next question from Molly. I'm only a year into my journey with this. My first echocardiogram was normal. Just had the second, and there were changes of mitral and tricuspid regurgitation. Could this be an early sign? At what point, here's the real question, at what point do you recommend bringing a cardiologist on board to monitor these changes?
So if you've been told that maybe you have mild changes, now is a good time to get the cardiologist involved, because if the cardiologist confirms that this is likely related to serotonin, then you want aggressive therapy directed at reducing serotonin to a normal level, because you can halt the progression of disease. So I think getting the cardiologist involved early is a very good thing. If you're not involving a cardiologist, and if you don't have changes suggestive of thickening and retraction and scarring, then I think if you just get our current recommendation is just to get an annual echo if you have a neuroendocrine tumor.
What are the serotonin levels, or what serotonin levels will indicate potential cardiac issues?
Yeah, I'm smiling because that was the question asked when I first got involved with the European Neuroendocrine Tumor Society. We were all sitting around the table, and all these world's experts were asking me, and I stated it was about 250. Just off the top of my head, I wasn't positive. I went back and checked all of our patients, and it was at about 250, which is around just a little above the upper limits of normal. It depends which lab you use. But at about the upper limits of normal or a little higher is where you start to see the scarring taking place. And this is due to receptors on the inner lining of the heart, which are serotonin receptors.
Mm-hmm.
And when they're stimulated, that causes what we refer to as fibroblast proliferation, which is just a fancy way of talking about scarring. And so it's the level of about above 250 or so, we start to see it.
And so you just knew that innately.
Well, it was trying to think back over all of my patients. Where did I start to see it? And I was happy to go back and confirm that I was recalling accurately.
See, everybody, I told you he was a genius. From Christine, for lung nets and dip neck, can definitively cause pulmonary arterial hypertension. What is the current treatment to address this issue? Did you follow that?
Yes, I did. And I just want to preface it by saying I'm not an expert in lung nets. We use the pulmonary team at Mount Sinai whenever we have a patient with lung nets. So that I think that I would rather an expert answer that. The only thing I will tell you is that whenever I am involved, I do all of the routine testing for markers. And if serotonin is elevated, then I'm really concerned about the potential effects on the heart. By the way, I've stated that carcinoid heart disease is predominantly a right heart disease. Mm-hmm. So that if you see a patient who has left heart involvement, you have to ask why is it occurring? Because when the blood flows through the lungs, serotonin is supposed to be deactivated. It's carried in platelets, and somehow there's a mechanism which deactivates the serotonin so that when the blood comes back to the left side of the heart, it usually doesn't affect it. Mm-hmm. So if you see left heart involvement, you have to answer why. 3 possibilities.
Got it.
One is that you have a patent foramen ovale, that's communication between the right and left atrium, and blood goes across and affects the left-sided valves. The second is you have a lung net or a bronchial carcinoid, which is producing a high concentration of serotonin. And the third possibility is that the serotonin is so high that it can't be completely deactivated in the lung.
Got it. Thank you so much. And I appreciate you saying that. And for those at home, because I saw a couple people had liked that question, so I did want to ask, even though I knew that wasn't exactly your area of specialty, Dr. Zacks. But for those at home, we have had an episode of Luncheon with the Experts with Dr. Robert Ramirez. That is what he focuses on. So you can refer back to that. We also have a video coming out very, very soon, hopefully at the end of this week, if not next week, on lung nets and dip neck. So I will make sure that you're able to see that as well. So we certainly do have a lot of video content on that, exactly, because I know a lot of people are interested in that information. Just a little more than 10 minutes left. We're moving along. I know we have a lot of questions, Dr. Zacks. We have a lot of attendees today, so you are quite the draw, sir. From Anne, how often should a net patient get an echocardiogram? We've talked about echocardiograms quite a bit today. How often should a patient get one? Yearly, every 5 years? What are your thoughts?
So, Anne, what we're currently recommending is an annual echocardiogram if you have a neuroendocrine tumor. However, then we're guided by the findings on that first echo. And if you have any changes at all, then we look at the markers and see how serious is the problem, how rapidly is it changing, how aggressive is the problem. And so we decide, are we going to do an echo every 3 months, every 6 months? We decide that based upon how aggressive the disease seems to be progressing.
Great, thank you. I just want to say, Dr. Zacks, a couple of people have mentioned in the comments the great questions that we've had, and then a friend of the foundation, Pat Murphy, also a previous guest on the show, says great answers and such clarity for all of us. I have to say that I agree with her 100%. A lot of what we talked about today is very, very high level, but you do a really good job of making it clear and easy to understand for someone even like me. So. People and I appreciate that. Let's see, from Loose. I have swelling on the feet and ankles for more than a year, but is sporadic and can stop for weeks. Is that common? I'll be having an echocardiogram next week.
Yeah. So
You had mentioned this
here
earlier.
the issue is to determine what's the cause of the swelling.
Sure.
And so there are multiple possibilities. And so, again, we start with a careful history, physical exam, EKG, chest x-rays, put it all together. We're looking carefully at the blood pressure because very often people with heart failure, if that is the underlying cause of the swelling, have high blood pressure. They tend to have uncontrolled hypertension. And so then we would direct therapy at that. And then as soon as we do the echocardiogram, then as I mentioned before, it's 100% sensitive and specific for carcinoid heart disease. So if you do have any involvement and you do have your echo read by an expert in carcinoid heart disease, they'll be able to tell you right away, is it really related? And the other benefit of having your annual echo, even if you don't have carcinoid heart disease, is that there are all these other things, leaking valves and thickening of the walls of the heart and decreased contractility of the heart, for which there's therapy. And so by just getting your echocardiogram, you reduce your risk.
Got it. Got it. Thank you. Question from Marcia. What do you think about the Benfesia pen to reduce serotonin coming from the liver?
I think they're really wonderful. What she's talking about is the newly available pen that instead of having you get a separate syringe and fill the syringe and give yourself your octreotide injection, it's loaded so that you can give an injection and all you do, it's just like an insulin pen. You just get rid of the needle, put on a new needle next time you need to give yourself an injection, and you carry your pen in your pocket. My experience getting it paid for by the insurance companies is horrendous because it's a newly available medication, delivery form for the medication. And so I'm fighting hard to get it approved for my patients. When I write a prescription and it's rejected, I try to make time to do the appeal. But I think it's just wonderful that it's available and you should pursue it. Try to get it if you can, if you're giving yourself multiple injections each day.
Awesome. Thank you. And thank you, Marcia. I just want to say again, we actually had a special presentation. I know some of you were there a couple of weeks ago, I think before the end of the year, with Dr. Lowell Anthony and a patient who we talked a lot about the pen. So that was December 14th, I believe. So a few weeks ago, but it's still here on the videos tab on the Facebook page. And literally, you know, a big chunk of that whole session, which was about carcinoid syndrome and managing breakthrough symptoms, was about that. So definitely refer back to that if you have questions about the pen. Moving along, question from Dr. Robert Ramirez, who we've already talked about today. Didn't even know that he was here. He's always here. He's like the Phantom of the Opera, kind of lurking in the shadows. And, you know, when we're floundering, right, when we're floundering, sometimes he'll like swoop in and give us the right definition to something. But today he has a question. He says, "Hi, Dr. Zacks and Rain. Great talk today. We're seeing more and more cardiac mets picked up by dotatate scans. What's your usual workup and management for these in a patient who's asymptomatic?"
So I think Robert is referring to metastases within the heart. And this
Correct.
Occurs in about 5% of our patients with the syndrome. And of all of the cases that Dr. Warner and I have had together over the years, we had not had to operate on a single patient, although I heard an anecdote about a patient on Long Island who apparently went for surgery for a cardiac met. The way we decide is by imaging it with an MRI, cardiac MR, and by the echocardiogram. And if it's having some effect on the function of the heart, then we do something about it. Now, I just said something that was not 100% accurate. I did send one patient about a year ago for surgery for a cardiac met. And this was the situation. This patient had the carcinoid syndrome, was referred to me to screen for carcinoid heart disease, had no evidence of serotonin effect on the heart, but had an isolated cardiac metastasis on the inner wall of the right ventricle just below the pulmonic valve. We sent him for a very simple, quick cardiac surgery. They removed that tumor. The patient remains free of any evidence of carcinoid heart disease. And if the patient had not been sent for the screening echo, that patient was at risk of the tumor breaking off, plugging the output through that pulmonic valve, and could have died suddenly. So that baseline echo saved that patient's life and is very important. And I had forgotten about that one case that we had operated on.
Well, thank you. I appreciate you including that. I think, folks, we have time for maybe one more question, maybe two. I have a question, Dr. Zacks, from Joanne, who says, what treatments are available to one whose tumors have no receptors? I too have heart problems. It appears options are limited when inoperable and no receptors. Any thoughts for Joanne?
Okay. What I would ask Joanne is, are there elevated levels of serotonin? Because that will make me think in terms of what's really going on with the heart.
Got it.
So I'm interested to know that. And if serotonin is elevated, then we're going to jump on serotonin right away, get that under control. And we're going to look at the function of the heart and which valves might be involved and what can we do about the valve disease. And we're trying to distinguish because a patient can have valve disease from some other cause, which is not really carcinoid heart disease. It's not really caused by serotonin, but it's equally important for that individual patient. So we want to define what's the problem, what is causing it, and then we know how to direct the therapy at it.
Karen had a question regarding serotonin. Can melatonin reduce serotonin? Ever heard of that?
I'm unaware. I prescribe melatonin in very tiny doses for people for sleeping.
Sure.
Because it's a natural substance within the body. I'm unaware of any literature, and I'd be interested in case there is something written about it having an effect on serotonin production, but I'm unaware of it.
Sure. Yeah. I thought that was an interesting question from Karen. I'm aware of melatonin, but I didn't know about that. So maybe we'll find out. Dr. Zacks, we got about 2 minutes left. I'm curious, based off of what you've seen over 30 years of doing this, what are the simple things people can do to give themselves, to take care of themselves the most when they are diagnosed with this disease? You've alluded to, you've talked about things already, like, getting consistent echocardiograms, bringing in a cardiologist sooner rather than later. What are some of the simple pieces of advice? Obviously, this is a complex disease. Obviously, each case is unique, but are there common things that you see people having the most success with this repeatedly do?
So most of us agree, those of us treating patients with neuroendocrine tumors, that in general, it takes a team of doctors. No one of us really is an expert in every aspect of the problem. And so the first thing is to see a neuroendocrine tumor expert, because he knows what kind of team to pull together. And the second thing is, don't ignore your other medical problems, because if you take care of those, you're stronger, you're better able to take care of your tumor and to undergo whatever kind of therapy is recommended. So don't stop taking care of your other problems.
I think that's such a simple but such a valid point. Thank you so much for including that. So, friends of the foundation, that is it for our show today. Thank you, as always, for joining us. And as always, we hope the program helped answer some of your questions. And if you have more questions or follow-up questions, again, a reminder to reach out to ccf@carcinoid.org for further information or follow-up questions. You can also reach them privately, message them here on the Facebook page. Thanks again to our presenting sponsor, Tercera Therapeutics. We could not do this program without them. And thanks to you, Dr. Zacks, for being so amazing, so full of knowledge and energy and passion about this. I know that the people are appreciative. I also am appreciative of your time.
It's such a pleasure being with all of you. I really, as most of you know, this is what I enjoyed.
That is very clear. It shines through with every answer that you give, and anytime I interact with you, it's very clear that this is something that you're passionate about, and we appreciate that. Everyone, I am
Thanks to you, Rain.
Absolutely, I appreciate it. Everyone at home, my name is Rain Bennett. Thanks for watching. I have been your host today for Luncheon with the Experts. Please join us next time. We'll be back next week. Stay healthy, stay safe, everybody. Bye-bye.